Hi, everyone. My name is Mark Bates. I'm a metabolic health coach, and today's topic is reversing the metabolic health crisis, empowering patients through evidence based nutrition. All right, here we go. This should be a good one, folks. Okay. Um, this is very interesting. Did you know that medical schools teach nutrition that kills patients? Well, that's the way I'm going to put it, right? It it's startling that medical students, the future healthcare providers, score lower on basic nutrition tests than receptionists in a little test done in Australia. The stark contrast in knowledge levels underscores the pressing need for a significant overhaul in medical education. And we've talked in other videos about how there's so little actual nutrition being taught to doctors in medical school. Because they've got all kinds of other stuff to get as well. But they should know some basic stuff. Okay, this shocking revelation uncovers a grave failure in medical education that directly impacts every patient stepping into a doctor's office today. With 88% of American adults developing insulin resistance and 98% having some form of metabolic disease in the first place, right? It's alarming that their physicians are still advocating the very dietary patterns that have led to this metabolic crisis. The numbers don't lie, revealing a systematic issue. Only 27% of medical schools provide the recommended 25 hours of nutrition training, and 58% of medical students receive no formal nutrition education during their 4 years of training. And for those who went to college, how much did you really pay attention to those required classes that you had to take? And the nutrition classes tend to be the required ones because they tend not to be the ones that help you pass the medical boards. Okay? Uh, just keep that in mind. This institutional negligence has a far reaching impact on patient care. More than half of graduating medical students rate their nutrition knowledge as inadequate. Once in practice, fewer than 14% believe they received adequate nutritional counseling training. The consequences extend far beyond individual ignorance. Okay, these are not actual pictures of patients. Okay, I just have to make that disclaimer. The standard of care that accelerates disease. Consider a typical patient encounter. A 52-year-old woman presents with borderline high blood pressure, elevated A1C of 6.2%, and a BMI of 32. Classic metabolic disease issues, right? Imagine being in her shoes. Her physician delivers standard dietary guidance. Eat a heart-healthy diet with low fat, lots of whole grains, fruits, vegetables, and lean meats. Avoid saturated fat. Choose whole wheat bread, brown rice, and vegetable oils instead of butter. And she faithfully follows this advice, replacing eggs with oatmeal for breakfast. This advice follows official ADA and USDA guidelines. The patient complies faithfully. She replaces eggs with oatmeal for breakfast. Her new meal contains 75 to 90 grams of carbohydrates from steel-cut oats, bananas, orange juice, and canola oil, following omega-6 recommendations. The metabolic cascade that follows demonstrates why this approach fails catastrophically. In someone with insulin resistance, cells already respond poorly to insulin signals. The 90-gram carbohydrate load floods the bloodstream with glucose, triggering massive insulin secretion. Because cells resist insulin's effects, insulin levels remain elevated longer and in higher quantities than usual. This hyperinsulinemia drives excess glucose into triglyceride production through de novo lipogenesis. That's the ability to actually create fats, right, from carbohydrates. The result, fatty liver disease, and this is done in the liver, and that's where the fat is normally stored. Visceral fat accumulation, that's the fat around the organs, not around the belly. Okay, that's the bad fat. and elevated fasting triglycerides. That's bad. As insulin drives glucose levels down too aggressively, reactive hypoglycemia triggers hunger and carbohydrate cravings. The patient believes she lacks willpower when her body demands more fuel, but it's just following the hormonal instructions, right? Over the months, her A1C has risen despite following medical advice. Weight has increased, blood pressure has worsened, triglycerides have climbed, and HDL has dropped, adding more markers in the metabolic dysfunction area. Eventually, medications get added. Metformin, statins, and ACE inhibitors enter the picture while the underlying hyperinsulinemia remains unaddressed. Physicians question patient compliance rather than examining their recommendations when these interventions fail. There's a biochemical storm hidden in plain sight. The metabolic destruction runs deeper than glucose dysregulation alone. Seed oils are recommended as heart healthy and contain high concentrations of omega-6 linoleic acid. These polyunsaturated fats integrate into cell membranes, making them unstable and prone to oxidation. Also, just keep in mind, it can take over 2 years for your body to replace these polyunsaturated fats in your cell walls with heart healthy saturated fat, which is what it wants to use. Okay, linoleic acid undergoes lipid peroxidation within mitochondria, generating toxic byproducts like 4-hydroxononyl. These compounds damage mitochondrial membranes and impair ATP production. That's all of the energy that runs your body is essentially ATP produced by the mitochondria in the cells, and you're impairing that. Damaged mitochondria cannot efficiently burn fatty acids, so you want to burn the fat on your body? Well, you got to have good mitochondria for that. Cells become metabolically inflexible. They learn to only burn carbohydrates, relying increasingly on glucose for energy while losing access to stored fat. Meanwhile, insulin receptor configuration changes as omega-6 PUFAs alter membrane compositions. Another reason you don't want that to happen. Insulin signaling becomes less efficient even at normal insulin levels. This increases your insulin dysregulation, right? You become much more much more insulin intolerant at that point, right? It becomes even worse. Okay, this combination creates a vicious cycle. Sugar drives the insulin up. Seed oils impair the cellular machinery needed to respond appropriately, and you just keep adding on to your metabolic dysfunction. The synergistic toxicity explains why processed foods containing refined carbohydrates and seed oils prove uniquely harmful. They hit you on multiple fronts. Fast food with fries cooked in soybean oil, burger buns, and sugary drinks simultaneously triggers simultaneous glucose spikes and mitochondrial damage. It affects your body completely. Within hours, glucose elevation combines with linoleic acid-induced 4-HNE production. The liver attempts to convert excess glucose into fat but cannot oxidize it properly due to impaired mitochondrial function. Triglycerides rise, muscle and liver insulin signaling deteriorate further, and the patient accelerates toward metabolic syndrome, which ultimately leads to type 2 diabetes and all kinds of chronic diseases. Okay, this is and it's all, for the most part, based on diet. The evidence medicine refuses to acknowledge, for the most part. Clinical trials have shown that low carbohydrate interventions have the potential to reverse type 2 diabetes in ways that conventional approaches cannot match. This is a beacon of hope in the field of healthcare, challenging the long-held belief that diabetes is a chronic, progressive, and irreversible condition. The Virta Health study tracked over 9,000 participants implementing ketogenic nutrition protocols. After 2 years, 53% of patients reversed their diabetes diagnosis. 53% reversed their diabetes diagnosis, defined as HbA1c below 6.5%, without medications or other than metformin. These results challenge decades of medical dogma, claiming diabetes represents a chronic, progressive, irreversible condition. At the cellular level, diabetes reversal follows predictable patterns when carbohydrate restriction removes the underlying metabolic stress. Lower glucose intake reduces pancreatic insulin demand, allowing beta cells to rest and recover, function. Insulin levels normalize, relieving the suppression of lipolysis and enabling fat burning to resume. Hepatic fat clearance occurs rapidly. That's in your liver. Studies show interhepatic fat can drop 30% within 7 to 14 days of carbohydrate restriction before significant weight loss occurs. If you're thinking you're going to just lose weight, no, you're actually healing your body, and it may not show up as weight loss. Okay, so keep that in mind. As liver fat decreases, hepatic insulin sensitivity returns. Your liver becomes more insulin sensitive. The liver regains its ability to suppress glucose output through gluconeogenesis, right? Stabilizing fasting blood glucose levels. Muscle cells simultaneously recover GLUT4 insulin sensitivity. That allows your muscles to actually take in. Insulin's part of taking in carbohydrates into your muscle cells for energy, right? And the GLUT4 pathways on your cells is how the insulin uses that to get glucose into the cells. Okay? Reduced insulin exposure resynthesizes glucose transporters while mitochondria clear lipid overload and restore oxidative capacity. The body has an incredible ability to heal itself if you stop giving it toxins. Inflammation markers like CRP and IL-6 decline as ketogenic metabolism reduces reactive oxygen species. You'll hear the term ROSs, ROSs. That's reactive oxygen species, right? Production, and activates antioxidant gene expression pathways. The reversal process demonstrates that type 2 diabetes represents a metabolic energy handling disorder rather than a blood sugar disease. The symptom that's easiest to spot is your blood sugar, but it really is a cell problem. It's right in the cell and the way it handles energy. Remove the dietary triggers and cellular function can recover. The resistance to acknowledge metabolic interventions is not just due to educational gaps. Historical evidence reveals a deliberate suspension of research that contradicts established dietary guidelines. A little side note. Pharmaceutical companies can't patent eating meat and low carb. Follow the money. Okay, this underscores the importance of individual action in seeking out and understanding the truth about our health. The resistance to acknowledge metabolic intervention stems from more than educational gaps. Historical evidence reveals deliberate suppression of research contradicting established dietary guidelines. Okay? Real quick, if you know the drill, please like, subscribe, hit the button if you want to get notified. It helps the channel a great deal. Thank you very much. Okay, we talked about suppression of contradictory research. It happens, okay? The Minnesota coronary experiment represents the most damning example of research suppression in nutrition science history. From 1968 to 1973, researchers led by Ansel Keys and Ivan France studied over 9,000 institutionalized patients. The intervention replaced saturated fats with corn oil high in linoleic acid to test whether cholesterol reduction would decrease mortality. Decrease the number of people who die, right? Cholesterol levels dropped as predicted in the intervention group. However, instead of improved survival, the opposite occurred. For every 30 milligram per deciliter reduction in serum cholesterol, the risk of death increased by 22%. The polyunsaturated fat group experienced higher mortality despite lower cholesterol levels, contradicting the diet heart hypotheses, which was pioneered by Ansel Keys. Rather than publish these results, researchers boxed the data, stored it in a basement for decades. Dr. Robert France, the son of the principal investigator Ivan France, later admitted there was a lot of reluctance around publishing data that contradicted what we believed. Independent researchers finally recovered and reanalyzed the data in 2016. Remember that date. 1973 is when they finished the study. Give them a couple years to publish and go through the data. Let's say 75 to 2016, right? That's a long time to hide the data, right? So he published the findings in the BMJ, which is the British Medical Journal, that showed no mortality benefit from saturated fat restriction and increased death rates from polyunsaturated fat consumption. The exact opposite of what the lipid heart people wanted. The Sydney Diet Heart Study suffered similar suppression. Participants who replaced saturated fat with omega-6 linoleic acid from safflower oil experienced higher all-cause mortality and increased coronary heart disease deaths. These landmark trials with hard clinical endpoints, a hard clinical endpoint is a mortality factor, right? You can't get much harder than that. Demonstrate that modern dietary guidelines, foundational assumptions, were wrong and actively harmful. Had these results been published honestly in the 1970s, the U.S. dietary guidelines might never have recommended replacing saturated fats with seed oils. Millions might have been spared the processed food era that fueled the obesity and diabetes epidemics. Instead, suppression allowed false consensus to solidify while contradictory evidence remained hidden. Yeah, it does happen. Okay? The metabolic health crisis by the numbers. The consequences of this institutional failure manifest in devastating public health statistics. Only metabolic health research shows that 12.2% of American adults maintain metabolic health, meaning 88% exhibit some metabolic dysfunction. It's actually closer to 90% now. But we don't have a lot of hard data to bump that number up higher yet. But it's looking that way. Okay? Only when you're looking at metabolic health do you notice this. Up to 1/3 of U.S. adults have full metabolic syndrome, according to Mayo Clinic data. Hyperinsulinemia prevalence increased by 46.8% from 1999 to 2018. Basically, right? 20 years. And hyperinsulinemia is what leads to insulin resistance and is the foundational problem found in almost all these chronic diseases. It's one of the key triggers, okay? These numbers represent more than statistical abstractions. They reflect millions of individuals developing preventable chronic diseases while following medical advice that accelerates their condition. The average patient visit lasts only 20 minutes, while providing comprehensive nutritional counseling would require more than 7 hours weekly per physician. This time constraint creates a symptom where doctors default to pharmaceutical management rather than addressing root causes. And this is not actually the fault of the doctors. Remember, most doctors are honestly, they got into medicine to help people. They don't want you to be sick, right? But they are employees of a corporation for the most part. They are paid based upon a scale of what they did, right? Most people get performance reviews at work. Doctors do too. The things that doctors are performance reviewed on, and this comes from the Obama healthcare. It was one of the side effects, unintended consequences, was they wanted to rate doctors for efficiency and how well their patients like their care. And so they started rating doctors, and one of the things was how many interactions per day. And an interaction could be talking with the patient, could be doing a test, from a laboratory test of some kind. It could be prescribing a medication. These are all basic interactions that are being measured. And then, of course, because the hospital corporations are owned principally by pharmaceutical and health insurance companies, but for a large part of the ownership, or where the money comes from. Well, there's lots of push from these companies to prescribe the medications that they make the most money off. Doctors get pulled in front of their bosses and get quizzed as to why they're not recommending statin drugs as much as they should be. Which means somebody's looking at the cholesterol tests that the doctor's taking, not looking at anything else, and saying, patient has high cholesterol. How come you're not prescribing statins, right? Now, this came out of Obamacare. Once again, it was an unintended side effect that they were trying to improve healthcare, and so one of the ways is to measure things that the doctor is doing and the satisfaction of the patient, right? And what you measure gets done. That's an old engineering term, and I'm an engineer by training. In many ways, I'm a software engineer, right? So what you measure gets done. So doctors are being measured by how many interactions, how many prescriptions they're giving out, and stuff like that. They're not being measured by, do their patients get healthy? That's a harder thing to measure. It takes longer. They have to work harder at it. Doctors have, 10 minutes with you? Maybe? On average, it's very hard to do much in 10 to 20 minutes. Okay? So don't blame your doctor per se. Blame the system that we put the doctors in. And, a doctor's gone to medical school, and he's gone to college, and he's got years and years in training invested in his career, or her career, right? Do you blame them for not endangering their career by not following the guidelines that figure out that directly influence their ability to make money and keep their career going? Right? There are doctors I've heard of who have lost their hospital privileges when they refuse to diagnose statins like they used to, because there was no evidence that the statins were doing any good. In fact, there's lots of evidence that the statins weren't helping at all and hurting, right? And a doctor without hospital privileges just can't function very well because they don't have the ability to admit patients and stuff, right? The whole system is that way. This is a problem, okay? So doctors, because of this time constraint, they default to pharmaceutical management, which means, okay, I've got a pill that helps reduce your blood sugar. Let me give you the pill. I've got a pill that lowers your cholesterol. Let me give you a pill. I've got a pill that lowers your high blood pressure. Let me give you a pill. I've got a pill that corrects your GERD and your stomach upset. Let me give you a pill. It's so much easier to do that, and it's what they're rated on. And who wants to get yelled at by their boss that they're not doing their job properly, right? I don't blame the doctors. I blame the system, okay? They're not trained, and they're not given the time to address root causes, which almost always on chronic diseases stem from diet. Medical students receive limited nutrition education, focusing on nutrients rather than practical counseling skills, right? Yeah, they understand the basics of nutrition in terms of you need certain nutrients to make the body work, you need to have certain vitamins, you need certain macronutrients to feed the body and stuff, right? They understand that, but they don't get into really how this all works in the body. They have the training, but it's not like something that they focus on year after year after year, and then when they graduate medical school, it's not drummed into them unless they want to specialize in this type of medicine, right? So you can't blame them. They have a heck of a lot that they have to pick up from in that 4 to 5 years that they're in medical school and starting to be an intern and all that, right? That's just a lot of stuff. Listen, don't blame the doctors. The doctors are really trying very hard, okay? But they have a limited education in nutrition education because, frankly, if I have to go to the emergency room, I'm in a car accident, things are broken, my body's spilling blood and stuff, I want the doctor who went through all that training and knows, I need this drug to stop this blood pressure issue and to help heal this. I know how to set this bone, and I know how to keep this artery from making you drain out. It's like, I want that, okay? But if I'm going to my doctor about my blood pressure or about the fact that my blood sugar is too high, that thinking that makes a good emergency surgeon is the wrong type of thinking for someone trying to holistically help you, right? Because they're focusing on individual little things, right? And fixing that little problem, missing the whole thing, right? It's the classic missing the forest for the trees. You focus on one tree and you're not seeing the forest of trees. Okay? So you can't blame the doctors. They're doing what they're being taught to do. They're doing what they're being paid to do. They're doing what their bosses are telling them to do. Right? So this is really why you need to start bringing stuff up yourself, and you need to start learning yourself. Okay? Physicians mean well, but they lack the knowledge and the tools and the training to deal with holistic healthcare, treating the root cause problems, which are almost always in metabolic health issues based upon diet. A little bit of exercise, a lot of rest, a lot of stress relief, but it all boils down to your diet. Okay? All right. The strategic pathway forward. We do have a way of getting out of this problem. Healthcare practitioners who recognize these failures face a challenging navigation between evidence-based practices and institutional expectations. Right? The path forward requires strategic courage combined with clinical competence and community alignment. Rather than arguing against every guideline, practitioners can anchor their care in physiological first principles. Most chronic diseases share a common pathophysiology: insulin resistance, mitochondrial dysfunction, and chronic inflammation. But the doctors who have the time to work with this typically are not the doctors that are on your health plan that you get with your insurance, right? They are cash-only type doctors who are out of the system. Sorry to say, but that's just the truth of it, right? If you want to take charge of your own health, you might have to look for doctors who have to ask you to pay out of pocket for their services and their knowledge, right? Building care models around restoring metabolic flexibility and lowering insulin load creates clinical defensibility, biochemically sound interventions that transform patient outcomes, but practitioners are at a problem because they're basically standing against the system when they try to do that. Right? There are now organizations like the Society of Metabolic Health Practitioners, Nutrition and Nutrition Network, and Virta Health. I'm part of both the SMHP and Nutrition Network. Virta Health, private organization, they don't allow people to join them. Okay, but they do a lot of great work, and they're backed by some very solid researchers. Right? They provide continual education, published protocols, and peer-reviewed frameworks. These resources create legal and professional protection for doctors by aligning with emerging standards of care rather than fringe ideology. That's why it's very important. If you have your doctor who's saying he can't help you with some of these problems because he needs research that proves it, ask me. I can help you get that research. I have access to all of it. I got thousands and thousands of different research studies at my fingertips on my databases that I can help you give to your doctor and help you tell you why he needs to read those. Okay? Documentation becomes crucial. Metabolically focused informed consent should clearly explain the rationale for nutritional interventions. Present alternatives and cite peer-reviewed literature supporting carbohydrate restriction approaches, right? Not too far from where I live is Duke University, where Dr. Westman, for 20 years, has been actively researching low-carb, carbohydrate restricted diets, and has been writing about it, and he's been seeing patients 4 days a week for 20 years, and he's got the clinical evidence. It's still not accepted throughout the world because it's against the system. Right? The things you can do is take care of your own health. You're in charge of it. Okay? As a community, we can help each other. We can train. We can teach each other what's real. We can provide you educational resources. We can provide you the statistical documents that your doctor needs to help you. Most of us, if we're working for a corporation, let's say, we have a health plan. That's one of the big ones, a Blue Cross, a Cigna, something like that, right? And the doctors that are on their plan are going to be forced to follow certain guidelines. But if you can say, I don't want to take statins, and here's the clinical evidence of it, the doctor may even agree with you, right? But nothing says you have to take the pill. Just telling you, okay? You make your own decisions in life. You're in charge of your own health. Your doctor is one of your best guides. They want to help you. But ultimately, if you've read the research and you've been introduced to items and you say, oh, you know what? I'd rather eat a carbohydrate restricted diet. I'd rather help my body heal itself. And if my cholesterol goes higher because I'm eating saturated fat, that's okay, because there's actually a lower mortality risk if my LDL goes up than if it goes down. That's what those other studies I mentioned earlier do, right? So just keep that in mind. Okay, the convergence that changes everything. Multiple forces are converging to make continued institutional denial impossible. Clinical evidence continues to mount from high-quality trials demonstrating diabetes reversal, superiority in weight loss, and improvements in liver health, blood pressure, and inflammatory markers through low carbohydrate interventions. The evidence is there, but once again, you're fighting a very well-established system. But you have your own personal power to do what you want. Economic pressure will ultimately break ideological resistance. Diabetes costs the U.S. healthcare system over $400 billion annually, and it's going up, with 90% of that spending directed toward chronic, preventable metabolic diseases. We're at a point where the healthcare system is about ready to go bankrupt. It can't keep up with this, and part of this is getting health insurance companies to understand that they can't default to what's in the system automatically, that they have to be willing to fund people's ability to get healthy instead of sick, which is, by the way, also a byproduct, an unintended consequence of Obamacare. Obamacare said health insurance companies, right, can only make a certain percentage profit, right? That of the money they pay out, a certain percentage can be profit for them because they have to pay for all the people who do all the paperwork and make the systems available and pay the doctors and all that stuff. They provide a very valuable service, right? But because their profit potential is limited by how much services they give out and what services does an health insurance company give out, they pay bills and they pay the prescriptions, and they pay the doctors, and they pay for all the interactions, which are on the doctor side of it, right? And so if they want to make $1 billion of profit, they need to push hundreds of billions of interactions payments out, okay? So they're incentivized to actually pay more for more interactions, not for you being healthy. We got to find a way for your health insurance to actually pay to make you healthy. Now, one of the things I like in the health insurance field are insurance companies that basically have catastrophic health care, and I'm not recommending anything. This is what I like. It has catastrophic care, right? You get in a car accident, you're in the emergency room, this stuff costs thousands and thousands and thousands of dollars a day. You have health insurance that helps cover that bill, right? But for the most part, the first, $5,000-$10,000 is covered by your health savings account, and your everyday interactions with your doctor is covered by your health savings account, not the insurance company. And buying the normal small prescriptions are covered by your health savings account. I love that program because guess what? Whatever you don't spend at the end of the year in your health savings account goes into some form of typically some form of a fund, or maybe even all the time. It depends on your health savings account. That is an investment-based fund that, after the course of many years, when you retire, can be used to fund your retirement. So you actually get the money back. So you're incentivized not to spend money that you don't need to. So you can question the doctor, why do I need this expensive drug when I really should just be changing my diet to fix my problem? And your doctor really can't argue with that thought, that process, especially after you change your diet and all your health markers improve. Okay? It's coming. It's going to take a long time. So in the meantime, don't rely on the doctor's advice 100%. You're your own CEO. Look into it yourself. Learn something and take care of yourself. Okay? So finally, the future belongs to the practitioners who choose evidence-based truth before it becomes institutionally safe. But they're on the edge, right? Sometimes that means that you have to make some changes in the way you respond to healthcare by paying for a little bit more upfront out of your own pocket or out of your HSA until you reach a certain point where the insurance kicks in. But understand that if you're paying a lot for metabolic diseases and you get metabolically healthy, you're not paying for that stuff anymore. And so all that money in that HSA, I'm just using that as an example, goes right back into your investment accounts, which ultimately helps fund your retirement. Right? It's good. So get metabolically healthy and save the money you've been spending on doctor bills for things that you can fix by eating properly. Okay? Medicine will eventually acknowledge what metabolic practitioners already know. Chronic diseases are largely reversible through evidence-based nutritional interventions that address root causes rather than managing symptoms. Okay? The only question is how many more people will suffer because their health insurance and their doctor, who's an employee for the most part, right? And the system is built not to make them healthy, but to manage their symptoms, which means giving them more and more medications. Okay? You have the ability to make some changes on your own. Take part in that. All right. Thank you for watching. If you have any questions or comments, go ahead and leave them there. Remember, I'm not a doctor. I'm not prescribing anything. I'm not telling you to not take your medication. What I'm telling you to do is get educated and talk with your doctor about these things. Maybe you don't need to be on as much medication if by changing your diet you can fix some of the metabolic issues that are showing up as blood work issues or lipid profile issues and stuff, right? Getting healthy is cheaper and better for you than taking more medications, right? No one got healthy because they lacked. No one got more healthy because they lacked pharmaceuticals and they took a lot more pharmaceuticals. All right, that's just bottom line. It only makes sense. Okay. And if you have any ideas for future episodes that you would like us to produce, remember, this is a community. We're here to help you. Go ahead and leave that comment, and we'll work on it. Thank you very much.